Good evening and welcome to Monday's Midlands Today from the BBC. Tonight, sacked for exposing patient neglect. A student nurse working at Stafford Hospital says she's been thrown off a course for whistleblowing.
Yes, Barbara Allett says she saw patients left in soiled beds and others with dementia being shouted at, allegations denied by the hospital.
Her story comes after a damning report condemned patient care at the hospital as appalling, saying it could have led up to 1,000 deaths. She's been talking to our health correspondent, Michele Paduano.
She had dreamed of becoming a nurse, but the uniform is going back. 40-year-old Barbara Allett claims she witnessed dementia patients being shouted at, the elderly in soiled sheets, and a sedative slipped secretly into a cup of tea at both Cannock and Stafford hospitals.
Drugs were just left on the tables, and dementia patients would be walking round into other cubicles and they'd be shouted at. I'd heard another nurse shouting at a patient, telling her to shut up. Lots of incidences really, people being left in wet beds longer than they needed to be. The nurses weren't helping, they could see that, you know, we needed help, the health carers needed help.
Stafford Hospital has said that it has no evidence that she was bullied. It says that there were concerns about her attitude, and although her allegations were investigated, they were without foundation. Miss Allett's mother says that her daughter's health has suffered.
She's worrying all the time, because she does want that, definitely. She's so into nursing.
The university, which monitors training, added, the decision to withdraw the student from the course was taken by the university, having followed Faculty of Health fitness to practice procedure. Should the student remain dissatisfied with the outcome, she has the right to take her case to the Office of the Independent Adjudicator. Miss Allett is unrepentant.
There's a fear culture going on, and there's definitely a bullying culture going on with mid-staffs, and it needs to be stamped out and stamped out now.
In the cafe where the Stafford campaign, Cure the NHS, was first concocted, the former student nurse has full support. Here they believe it's Mid-Staffordshire Hospital's reaction that's a recipe for disaster.
We've seen witness statements, and we've seen the representation that the RCN have given her. And, you know, Barbara is the type of nurse that is needed at Stafford. We're just absolutely flabbergasted.
Miss Allett says some nurses were very caring, but she feels she was punished for whistleblowing. She's been left tending her garden rather than patients. Michele Paduano, BBC Midlands Today.
Well, whistleblowing is still a controversial subject and can have serious consequences. Dr. Raj Mattu from Coventry was at home on full pay for more than 5 years after blowing the whistle on the treatment of heart patients.
Well, the charity Public Concern at Work offers advice and support about whistleblowers, and it actually submitted a report to the Stafford inquiry offering advice on the subject. Well, earlier I spoke to the charity's Deputy Director, Cathy James, and asked what reaction people get when they decide to speak out.
Well, that depends on the organisation that they work for. A good organisation, one that's enlightened, shall we say, will recognise that it's in their own self-interest to encourage people to speak up and to deal with the issue that they raise in a proportionate, fair, quick way. A bad organisation will not be so interested in that reaction.
Is there any legal protection for people who feel they want to speak out?
There's very good legal protection in the UK. It's called the Public Interest Disclosure Act, and it gives a route to compensation to the Employment Tribunal. But you could say that that's actually a measure of things going wrong. You know, every time the Public Interest Disclosure Act needs to be used, it means that a whistleblower is saying they've been treated badly or dismissed because they've raised a concern about malpractice. You know, I would suggest if you're in that situation, it would make sense to take some advice from either your union or from Public Concern at Work, because, you know, just to step back and think about how you raise that when you're going externally is quite important.
Things improving? Are people more willing to speak out these days?
I think there is a better reaction to speaking out and whistleblowing in the UK, but there is still a lot of work to be done, as mid-staffs and the, you know, the palpable lack of whistleblowers at mid-staffs illustrates.
Cathy James, thank you very much.
Thank you.